Dr. Gold, what do patients tell you? What have you experienced from patients after they had surgery? And they probably had things before. They had glasses or contact lenses before to kind of like subsidize for they're not seeing one way or the other way. And then all of a sudden they make the jump and go into LASIK surgery. What's their reaction after they come out?
The most exciting reaction is the same one I had when I was a child and got my first pair of glasses. And I can remember it as if it were yesterday. When I left the optical shop, I said to my mother, "Mom, trees have leaves." I had never understood before that trees had individual little green things.
It was just a big green ball for you.
Exactly. That's what it was. And so I hear that story every day from my patients about when they got their first glasses, they understood that trees have leaves, but now they can see the little veins on the leaves. They can see license plates that they never could see before. They can see street signs that they could never see before. They can see their baby's eyes. The stories never end. Every day I hear these gratifying stories about things that patients can see now that they really couldn't see before, especially that they can see them without glasses. And that's really exciting to me.
Right. So basically, so what you just said so far, obviously it's touching. But there is also the aspect of you don't need to put your glasses on. Now, not everybody thinks that a glass is an ugly thing. That time is gone. They make Gucci glasses. It's all very pretty and fashionable. It's fine. But if you want to wear glasses, wear some shades, look good. But actually, in terms of like putting them on, especially the people who need reading glasses, nearsight glasses, who kind of like, and I have heard that even the best bifocus lenses, be it on glasses or be it in contact lenses, there's a little bit of give or take in order to make them work. Is that true? And does that go away by the time you have a surgery?
Well, wearing glasses makes the vision, although it makes it sharper, it makes it unnatural because the edges of the lenses distort the vision. The eyeglass frame itself limits the vision, so people have to turn their head instead of just turning their eyes. It's very difficult to wear glasses when you go swimming. So you have to take your glasses off, and then you can't find where your blanket was on the beach or where your kids are. And so I hear that story repeatedly. It was great. The first time I was able to go swimming.
As long as you see the shark coming, it's all right.
Right. The problem is you don't see them till it's too late. But people are able to find their way back up the beach to where their family is after they've been in the ocean. And I hear that all the time. People who mostly swim in a pool, if their kid wants to jump in the pool and they don't have their glasses on, that can be a little intimidating. Whereas once they've had laser vision correction, those problems disappear.
Right. Now, you brought up a very, I didn't even think of that. Like, you have those sports activities, where you can't, whether you like the glasses or not, but you can't use them for it, and etc. And in fact, now that you mention it, I've noticed sometimes when I go to the gun range, I'm always debating, should I put those things on, those reading glasses, in order to aim better, or should I take them off because I really look at the target up front, and there's always that little bit that compromise. Yeah.
Right. One of the other sports that we didn't mention is I'm a skier. And people who ski.
Talk about it. I ski lots.
People who ski wearing glasses, frequently the glasses will fog up inside the goggles. Or when they fall, they lose their goggles and their glasses both. Whereas they have laser vision correction, that becomes a non-issue anymore.
Right.
And so I hear, living here in the Northeast, a lot of my patients are skiers. And so this really creates better ski experience, not having to wear glasses or even contact lenses when skiing.
I haven't experienced that yet because I don't put on my reading glasses when I go down that hill.
Of course.
But
I'm also a scuba diver.
Yeah. So, by the way, a person with lenses, can he jump into the swimming pool or into the ocean with the lenses in it?
As long as he doesn't open his eyes.
Oh.
Because the water can wash the lenses right out.
Oh. Oh, well, that's not good. So basically, he always has to then wear, the diving glasses or whatever. Okay.
That's right. I'm also a scuba diver, and scuba diving without your glasses on, you really don't see very well, and there's beautiful things to see down there. Scuba diving with contact lenses can be done, but it's a little bit dangerous because if your mask fills up with water, you lose your contact lenses. So I have scuba divers that I've done this surgery for who just are excited about being able to scuba dive without visual correction.
Well, it looks like very obviously you have a much less inhibited life because you don't even know when and what it comes to. As I said, for me, it's having the glasses on and trying to back out with the car and not knowing it going to the cell phone and having to switch back and forth, whatever it is, there's some inconvenience there. And when it goes to sport and certain things, it's probably, that's wonderful. So let me ask you, do colors appear? You said something about, when you have contact lenses and you need to have them, because you go down there scuba diving and you do other things in Mother Nature out there because you want to see the color. It's colorful, it's beautiful. So with the LASIK surgery, do colors become also nicer, brighter, and more defined and all that stuff?
No. There's no impact on color vision perception with laser vision correction.
Just if you were blurry, then the red goes into blue and you don't know where it starts. It's just a ball. You cannot so that stuff. But the color in itself stays the same. Well, anyway,
that's right.
I'm sure that. So basically, the consent is when people walk out of that surgery. Did you ever have anybody saying, "I wish I never done that"?
Not in my practice. There are some patients scattered around the world, I guess, who have had some complications and wish they had never done the surgery. I warn all of my patients beforehand that their eyes will be drier afterwards than they were before for a time. And it's very rare for a dry eye to last the rest of your life. I warn all of my patients that for the first few weeks after surgery, they'll see some glare and some halos and other optical symptoms, but those all resolve really rather quickly.
Okay, and that dryness it gets fixed how? By using eye drops and stuff like that for the rest of your life?
It's rare to need them for the rest of your life, but I tell all of my patients to anticipate that they will be using eye drops and fish oil in pill form to ward off the dryness for at least the first 6 months.
I got it. Well, all right.
And this is less of an issue with epi-LASIK than with LASIK, that's for sure.
Well, all right. So we have three things with epi-LASIK. We have not being cut, that flap, basically a complete healing of the eye, where with the normal LASIK surgery there's a small part which doesn't heal, doesn't really matter what that is now, which is then always dangerous if the eye gets poked or so. And then there's the fact that you most likely have less dryness in the eye compared to with the normal surgery, the normal LASIK surgery.
That's correct.
Well,
another issue that's a difference with epi-LASIK is that people who were not candidates for LASIK because their corneas were too thin to have the procedure done frequently become candidates again with epi-LASIK because it doesn't remove healthy tissue.
Oh, wow. So some people have been refused normal LASIK surgery because they simply were not candidate because their cornea was too thin from the beginning of it, for whatever reason. They could potentially be a good prospect and able to get that surgery and then live a better life with the epi surgery.
That's exactly true.
Great. If we keep talking, we keep finding another bunch of stuff. So we found 2 in the last few minutes here. Thank you very much, Dr. Gold.